From the Podcaster. Powered by Timber Media.
Can't remember when last a song from the 50s captured our collective imaginations in quite the same way. The song in question is Paas Nahi Aaiye from the 1952 film Saki, starring Madhubala and Prem Nath. This is a song that recently went viral. And yeah, the irony of using that particular phrase in these times isn't really lost on anyone, I guess. Well, the song itself, I thought, was a great way to drive home the point of social distancing. But has the point been driven home enough? Perhaps not. The global COVID-19 scenario has been a grim one, and India's population alone is expected to be a force multiplier. We can't be careful enough. In the coming weeks, what will be critical in the nation's efforts to contain the spread of COVID-19 is social distancing. While dry runs of self-imposed curfews sound like a good place to start, it would be unwise to think that just a day or two of such measures is going to suffice. We implore you, therefore, to wash your hands, maintain respiratory hygiene, and most importantly, follow the principle of social distancing going forward. But yes, the basics first. If you're unclear of what the term refers to, we hope this podcast will help you stay safe. Welcome to the Podcaster, powered by Timber Media. My name is Sheetal, and I'm handing over to Rakesh.
My name is Rakesh Sharma. Today, I'm going to bring to you some information about a phrase that you've been hearing far too much, be it your social media feeds, be it the news, be it newspapers, or just conversation around you. Everybody wants to be doing social distancing. You might have a few doubts about what you can or cannot do when you're socially distancing yourself, and what does the term itself mean? There may be a lot of confusion. What is social distancing? Who should be doing it? Who is it for? All of those questions answered right here. First, let's start with how aware we are of social distancing. Now, what is the term itself? Social distancing is a term applied to certain actions that are taken by public health officials to stop or slow down the spread of a highly contagious disease. It is being looked at as our best defense against the coronavirus at the moment. Social distancing measures are taken to restrict when and where people can gather to stop or slow the spread of infectious diseases. So what are the measures that come within the umbrella of social distancing? Limiting large groups of people coming together, closing buildings, cancelling events, things that you've been hearing about. Weddings have been called off, most parties and get-togethers, concerts have all been cancelled because we want to prevent the gathering of large groups of people. The Centers for Disease Control and Prevention describes social distancing as staying away from mass gatherings and keeping a distance of 6 feet or 2 meters, that is about one body length, away from other people. Social distancing also means not touching other people, and that includes handshakes. And that is why the bow or the namaste have all become popular now, as they should be. Physical touch is the most likely way a person will catch the coronavirus and the easiest way to spread it as well. So catching and spreading are all rooted in physical contact, and we want to avoid that, which is why social distancing. Social distancing can never prevent, of course, 100% of transmissions, but by following these simple rules, individuals can play a very critical role in slowing the spread of the coronavirus. If you think you're a person sitting far away where there are no cases diagnosed as of now, you might be thinking, well, I am not exactly a participant in the spread of this infection, and you will be thinking wrong. It is important for all of us to think that we all have a clear and central role in preventing the transmission of this virus. If the number of cases isn't kept below what the healthcare system can handle at any one point in time, hospitals could become overwhelmed, and that would lead to unnecessary suffering. And this is why we need to flatten the curve. What is flattening the curve? Flattening the curve basically means slowing the spread of the disease. If there is exponential rise in the number of cases being detected and an exponential rise in the number of patients being admitted in hospitals, it overwhelms the healthcare system. So our responsibility now is to delay that so that we are not putting more stress on the healthcare system. And does flattening the curve work? Well, yes. About 100 years ago, in 1918, during the Spanish flu pandemic, there was a case study between two cities, Philadelphia and St. Louis. In Philadelphia, city officials ignored warnings from infectious disease experts that the flu was already spreading in the community. The city instead moved forward with a massive parade that gathered hundreds of thousands of people. Whereas in St. Louis in Missouri, city officials quickly implemented these social isolation strategies. The government closed schools, limited travel, and encouraged personal hygiene and social distancing. The difference is, of course, stark. In Philadelphia, where there were no social distancing measures implemented, 16,000 people died from the disease in 6 months, whereas in St. Louis, only about 2,000 deaths. That's about 1/8 of what we saw in Philadelphia. So flattening the curve by socially distancing ourselves has been proven to be an effective method to prevent the spread of infectious diseases. Why does it work, and why is it so crucial, and who should be doing it? We'll find that out when we come back. So just to expand on what I spoke about earlier, about why social distancing works, if done correctly and on a large scale, social distancing has been proven to break or slow the chain of transmission from person to person. What you want to do is break the chain of spread. People can spread the coronavirus for at least 5 days before they even show symptoms. Social distancing, therefore, limits the number of people an infected person comes into contact with and potentially spreads the virus to before they even realize they have the infection. So yes, even if you're not showing any symptoms, it is prudent for you to practice social distancing. At the moment, social distancing is the only tool available to fight the spread of the coronavirus. Without a way to make people better once they fall sick or make them less contagious, the only effective tactic is making sure hospital-level care is available for those who actually need it. The way to do that is to slow or stop the spread of the virus and decrease the number of cases at any one time. And that is why social distancing is so crucial. I cannot emphasize this enough. Perhaps some of you listening are young and have the means to take care of yourselves or are blessed with good health, but it is not you that you should be thinking of now. It is those people who are the most vulnerable to the disease that you must bear in your mind. People who are infirm, people who are older than 60, people with prior conditions that put them at high risk, such as hypertension or heart disease or diabetes, or people with low immunity in general. So it is these people that we also want to protect. Social distancing, therefore, requires a little bit of sacrifice. It is not about yourself that you're thinking of, it is your entire community that you're thinking of. Which brings me to the question, who should do it? The answer to that simply is everyone. Everyone must practice social distancing in order to prevent a tidal wave of cases. If the public as a whole, irrespective of young or old, takes social distancing seriously, overwhelming the medical system could be avoided. And that is one of the most important goals of social distancing. Now that I've spoken so much about what social distancing is and who should be doing it and why it is so crucial, let's get down to brass tacks. What exactly should you and should you not be doing? All that when we come back. Let's start with some things that are safe to do. Play in your yard, clean out your closet, in the house, read a good book. That is always a good time to read a good book. Listen to music, cook a meal, family game nights, as long as again you're ensuring that you're not touching each other too much and are taking precautions to stay about 6 feet away from each other. Is it okay to do group video chats? Yes, in fact, it is encouraged. Several people could be living apart from their family. Some people might only have a social circle in their work settings. And when they're not going to work and are working from home, that isolation, that lack of contact with other people might take a toll on your mental health. So how do you avoid that? Group video chats. There is a way you can also schedule dinner times with your friends over a video chat. In these times of isolation, it is important to also consider your mental health and as much as possible, stay in contact with your family and friends, and you do not have to suffer through this alone. You know what else is safe to do? Checking on a friend and checking on an elderly neighbor. As has been demonstrated in various studies, the people who are most vulnerable to this disease are the elderly, especially those elderly people who also have comorbidities like high blood pressure or heart disease. So do check on an elderly neighbor if they're alone and find out how they're doing, and should there be any need for them to be hospitalized. These are all safe things to do, and perhaps some of them even responsible things to do. And finally, what are the things that you must absolutely avoid? Group gatherings, no. Sleepovers, no. Playdates, no. Concerts, theatre outings, crowded retail stores and malls, no, no, no. Working out in a gym, no. Try and get an exercise routine going within the confines of your house. And within the confines of your house, try and limit the number of visitors from elsewhere. You might be socially distancing, but the people who are coming to visit you in your house might not necessarily be. So why take the risk? Visitors in your house and non-essential workers in your house are also some things you should try and avoid. As also mass transit systems. I understand that public transportation is a way of saving money, is in fact encouraged for sustainability reasons, but in this situation, public transportation systems are best avoided. So that is a list of some things safe to do, some things that you need to be cautious about, and some things that you must absolutely avoid. Another thing that I keep hearing these days is, I'm young and I don't have any risk factors. Can I continue to socialize? As I said earlier, and I continue to repeat it because I think this is the most important takeaway, please don't socialize if you're young and don't have any risk factors. There is no question that older people and those with underlying health conditions are the most vulnerable to the virus, but young people are by no means immune. What they could be doing is they could be catching the disease, perhaps not showing as many symptoms as some of the older people might be showing, but they do inadvertently spread the disease to people who might not be able to handle it. So even people who show only mild symptoms may pass the virus to many others, particularly in the early course of the infection before they even realize they're sick. Like I said, sometimes it takes about 5 days for people who are infected to show the symptoms, and during that time, they might have passed it on to some of the most vulnerable people in the population, including older and high-risk relatives. You will end up contributing to the number of people infected and causing the pandemic to grow rapidly. So, to answer that question, if you're young and you don't have any risk factors, should you be socializing? Absolutely not. Try and not do it. Another issue to address in these times is also about mental health. I'm scared that I feel alone. Is there anything I can do to make this easier? Again, I reiterate, try and get as much contact with people via the internet. Talk to people on the phone. Arrange for dinner dates with people at the same time. Perhaps try and stream a film at the same time from both different places and enjoy it together. Just as important as it is to stop the spread of the disease, so it is to make sure that we are also taking care of our mental health. So there you have it, everything you wanted to know about social distancing and just how crucial it is in preventing the spread of the disease. We will, over the course of the next days and weeks, continue to give you accurate, reliable, and current information about the pandemic and what you can be doing to prevent the spread of the disease, while also making sure that the community around you stays safe. Until the next time you hear from me, this is me, Rakesh Sharma, right here on The Podcaster.
From The Podcaster. Powered by Timber Media.